All right, class. We're talking about different medicines, and Vecuronium is the one today. Vec is our long-acting non-depolarizing agent. Okay, so it's a non-depolarizer. If we remember from the one video that we did, remember that this blocks up the receptor sites and does not allow signals to go into the neuron, which eventually causes again, it can't be used, and it takes a long time. So your Vecuronium, by the way, your Vecuronium, your Rocuronium, Pancuronium, all of these guys are long-acting paralytics, okay? We don't usually use them unless we have the patient intubated and we know that that tube is ventilating that patient. Um, so again, Vecuronium is also known as Norcuron. Again, it's a derivative of Pancuronium, which is a little bit longer acting. So we use it to facilitate endotracheal intubation. More importantly, in the emergency world, we use it once we have the patient intubated to keep them paralyzed. Okay. So again, just like the succinylcholine, the the thing you got to remember about Vec is that it paralyzes. It does not sedate. Okay, you have to have the patient sedated along with this paralysis. So again, how it works is again it competes with the acetylcholine and cholinergic receptors at the junction. It blocks up the port. Okay, so that the signals can't come into the muscle fiber, and it does not cause initial depolarization wave like succinylcholine. So literally, they're not going to fire all at once. They're not going to have fasciculations with Vecuronium. They're just going to go stop. So it usually takes about 3 to 5 minutes for this to work, and the continuation of the effects is somewhere around the 25 to 30-minute mark. And it's actually a little bit on the dose-dependent side. If you give a heavier dose, it'll actually last longer. But for simple factoids, it's 25 to 30 minutes is how long it lasts. And that's important to remember because if you have a patient that is sedated, by the way, most of the time our sedation agents in emergency medicine only last about 15 minutes. So we need to provide continual sedation for that and resedate. But you also may have to reparalyze on an extremely long transport. Excuse me. So again, we use it to maintain prolonged paralysis. Okay? And then it's used in the effects with succinylcholine begin to wear off and the patient has been intubated. That's when we use it, okay? There are some doctors, there's been some times where they use Vecuronium as the initial induction agent. My only problem with that is if you miss the tube, you're bagging a patient for 30 minutes. And again, that's why we like succinylcholine for the initial. But once I got them tubed, this is the guy that I want to go to. 20 to 30 minutes of I don't have to worry about they're going to stay paralyzed. I do have to worry about keeping them sedated. All right. So again, you might get some skeletal muscle weakness. That's okay because and it does increase the intracranial pressure a little bit. Okay. You can get arrhythmias. These are usually due to the patient going hypoxic. You can still get hormonal dumps, so the hypo or hypertension can happen. And again, you got to maintain a close watch on those vital signs when you have the patients paralyzed. There is some increased nausea, vomiting with this, and the side effect is apnea. Well, no kidding. We're paralyzing the entire body. You can get some wheezing from this as well, just to be aware of that. And it does increase the intraocular pressure. So if you got somebody with glaucoma, again, use this with caution. Again, if they are hypersensitive to the Vecuronium or any type of bromide, you want to watch out for that. The potassium shift is not as bad as succinylcholine, but if they've got a history of malignant hyperthermia, stay away from it. Any penetrating eye injury, pretty much if it's the same thing for succinylcholine, it's the same thing for Vecuronium as far as using it. The other thing is we do not use this on any type of newborn. If they're under 28 days of age, stay away from it. There's other agents that work just as good. So again, if they're a bigger, fatter person, it takes a lot longer for this to work, and it actually it'll wear off a little bit earlier as well. If they got glaucoma, again, if they have hepatic or renal failure, it's processed in the kidneys and the liver. You might have some extended effects with that. Now, again, you got to be careful of the neuromuscular blockage, especially if you're using inhalation anesthetics. Okay, so again, in the operating room, which is kind of funny because in the OR they usually like to use this a lot more than they like to use succinylcholine. Um, so again, stay away from watch out for any type of the salts of verapamil. They can enhance the action of vector. So if you look over and you see any of these in their med list, again, they can enhance the effects of vecuronium. Again, the big one is the theophylline. It is a dose-dependent reversal of neurological blood station as possible. So if they're an asthmatic, take a really good look at their med list. Okay, take a real strong look at their med list. I get my slides to advance here. They don't want to advance. Unbelievable. Here, we'll try it this way. All right. So again, you need to explain the medication. You need to make sure that they understand what it's going to be. If you're going to use it on somebody, the real key thing is that they come out of the sedation. They need to be aware that they're gonna can't move at all. Okay, and again, you definitely need to use a sedative and an analgesic. Okay, sedatives do nothing for pain. It makes you forget that you're having pain. Paralysis doesn't do nothing for pain. It does nothing for sedation. Okay, so again, start thinking about using your fentanyl. Start thinking about using the Versed, etomidate. Usually we use etomidate for the induction. Versed is what we usually use to maintain the sedation. That or Ativan, one of the two. And then provide care for the eyes. Again, make sure you cover it so that they don't have any problems with the eyes. So again, you need to be sure that you've got ventilatory support available. Okay, if you're using this, if you're using VEC, usually you put a patient on a ventilator. If not, remember, if you stop bagging them, they will stop breathing. Okay, again, just like succinylcholine, this does not stop neural activity, especially if it's nothing but neural activity. So it doesn't stop a seizure. Okay, you might paralyze the muscles, but it doesn't stop the seizing from actually happening. And then there's no known effect on consciousness, pain threshold, or cerebration. In other words, these people can still think. They can still process. And so that's why, again, make sure your patient's good and sedated. Watch your heart rate, okay? If you see that heart rate shooting up, more than likely, they're aware of what's going on, and you need to give them a sedative so that they are unaware of what is going on. All right, so your pulse rate does increase the cardiac output, and prior administration of succinylcholine may enhance the effects. So again, your first dose might last 30-35 minutes versus if you've given it just after succinylcholine, okay? This thing's not cooperating. Again, it's usually 10 milligrams. It's reconstituted with 1 milligram per milliliter. It's usually 10 milligrams and 10 milliliters is what we usually get. Your adult dose, 0.08 to 0.1 milligrams per kilogram. I'm going to make it really simple for you guys. 0.1 milligrams per kilogram. If I gave 100 milligrams of Sux, I give 10 milligrams of VEC. Okay? Again, we give it slow, 30 to 60 seconds, and that's to help prevent the wheezing effect, actually. Pediatric dose is the same, and it may require up to a higher dose for our children from 1 to 9 years of age. So you may have to go a little bit higher on that. Or more importantly, you usually give the 0.1, and then you have to redose them a little bit earlier than you were expecting to redose them. Pregnancy class, it's a class C. I've used it on a few pregnant patients. It's worked well. There hasn't been no fetal problems. Usually the fetal problems come because we didn't ventilate mom good enough, and therefore the baby went hypoxic while in the womb. All right, so again, by the way, we only give this IV. We do not give this IM. We just give it IV or IO. All right, that's it for VEC. Again, remember that vecuronium is a non-depolarizing agent, okay? So it lasts a lot longer, okay? And we only use it once we have the patient intubated. All right, guys, I'll see you on the next one.